All right, welcome back. Today, I actually get to be joined by Dr. Michelle, my mom. I hate
Oh,
calling you Dr. Michelle, but I feel like people should know that as a
funny.
title.
That's funny.
Um, but we want to talk about and dive into, obviously, there's a lot happening with the Make America Healthy Again movement, I guess it could
Yeah,
be
I wish
called.
I would have my hat. I have a Make America Healthy hat.
Yeah. Obviously, because we're in the wellness industry space, like the health and wellness space, we wanted to talk about it. We haven't posted or said much since the election or anything. Just we're we're observers first, comment later. And even, it's been a few weeks. Still feels early to be making comments, but
It's
whatever.
only been a few days
Yeah,
since
since
Robert Kennedy
yeah.
Jr. was announced as HHS secretary.
Just it's
Still
been great.
smiling.
Yes, it's been craziness
Yeah.
on the internet. So, we're just gonna give our thoughts, what we're seeing so far, both pros and cons, honestly, and kind of walk through some of the things we're seeing today, and then also what we would like to see. In all honesty, like, if we're talking about making America healthy again, like these are the things that we think would be important to establish as policy, maybe, or just whatever word you want to think, whatever you want to call it.
Mhm.
Um,
I would
so
go so far as to say some of these should become law, but that would be just me, probably. But I don't know. When I'm on the call later with, when he calls me to get our opinion, we can give him all that
mm,
information.
yeah, we can let him know. Okay, perfect. So just to dive in, we'll talk first about RFK, his health concerns, what his concerns are about health in this country, why people are divided, and then kind of either go into like some myth busting about the division or even like validate some concerns here. So, um, you've probably heard, if you're listening to this, and you've probably heard about RFK Jr. and how he's kind of making waves right now. He's really talking big on vaccines, health policies, and pharmaceutical companies.
Yes.
Those, as well as his environmental
Yeah,
policy.
but I mean, why don't we could just talk about him for just a second and maybe
Yeah,
just a brief little
go ahead.
overview. And I mean, there's I'm going to start by saying that there's a lot of, not a lot, but there are things. It's like we're not all in for this guy. Like there are things and beliefs he holds and things he said, whatever that we or me, I'm not going to speak for you as well, but it's like,
Oh,
don't fully agree with. I mean, there isn't anybody but yourself that you're going to fully agree with.
and that's
So,
okay. Yeah.
but just like a little background on him and his big thing for 20 plus years, he's an environmental lawyer. And he has been on the forefront of some really, really big and important cases that I think have really improved the health of the country. One, his biggest one, or his kind of one of his more memorable ones, is smoking and how detrimental that was to people's health. I mean, so it's not just about the environment from a food standpoint, but he's done it from all areas. So anything that he has touched a lot of big wins. Another big one was Monsanto and
Glyphosate.
yeah, thank you. That was, another big one. That is a huge win for all of us. Proven to cause cancer, proven to cause a lot of neurological damage, proven to do a lot of things that, should have never been sprayed and used in anything, in our world. So, I mean, those are just a couple that come to mind that, from an environmental standpoint, I mean, I think he's done a really good job in looking at the greater good and public health from that perspective, even.
And
Um,
he's to date probably one of the most successful environmental
Yeah, I
lawyers.
think I saw something once. He said like he's won over $1 billion
Mhm.
against these large companies.
Which, people want to say he's not qualified for the position.
I know, I
But
don't. Yeah.
anywho.
So yeah, and so when you think about HHS, he is over the FDA and the CDC. Again, can't stop smiling. But But that doesn't mean that he is in control of, every little minute detail of our lives. Like that's not the promise of having Kennedy going into this position. What it really is. Well, anyway, finish talking about him. So yeah, so he's been a big advocate about transparency, 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 transparency. Like that to me is huge. We should all have all the information. Nothing should be held back from us. Nothing should be unable to be able, we should be able to get whatever information we want without going through, the federal rigmarole to try and get access to documents or whatever. It's like we should have access to all of our health, whatever's going on behind the scenes. FDA is coming out with a new drug. I want to see every study they did. I want to understand what the board talked about before they passed, and said it was safe for public use. You want to talk about the CDC,
especially as a medical professional and with a
sure.
medical license. Like
Yeah.
these things should be available, if yes, to the everyday consumer, but most of us aren't like gonna go. We trust that the people that we're going to for our health have this information. It's readily available, and it's not.
Yeah.
So, anywho, just.
But I think, and then, thinking about it from what Robert Kennedy Jr. has been talking about and what he wants to do once he was given this position is the corruption. Oh my gosh, the layers and layers and layers of corruption in the FDA and the CDC, which is they are those organizations, and NIH as well. Those organizations are responsible for public health. Like that's their whole job. And they are so far removed from that because of the underlying corruption. And one example of when I say corruption would be, oh, hi, I worked for Merck. I was, in the C-suites of Merck for 20 years, and I'm thinking of leaving and retiring. And so, oh, hello, FDA, can I come over here and be a board member now? And then I'm going to make sure that my old company, which I'm still getting benefits from and kickbacks from, et cetera, is going to, their things are going to get pushed through. Like that's bull crap. So, anyway. Yeah, so those are some of the things that I think I guess I'm not understanding why people are so, this is horrible for us, because it's like if he would just do that alone, imagine the positive impacts that would happen in our country. I don't know if people understand that most research is done by pharmaceutical companies. How does that benefit me? It's not independent research. It's not independent from the people who are trying to sell you a product. It's funded by the people who are trying to sell you the product. Well, how do you think those results are going to get spun? I mean, it's, I could talk all day. I know we don't have that much time. So anyway.
Yeah. I'll say this just to guide through the conversation a little bit, but and we can expand on some of the things that you just said. But the major division, like why people are so divided, you have his concerns. So he is a big advocate for transparency and safety in vaccines. We're going to touch back on this because people think that he is against vaccines. That's not entirely true, but we can go into that a little bit further in a second. He talks a lot about environmental toxins and how they might affect our health given his background. And then he's critical of the pharmaceutical companies, government agencies, and some of that corruption that's happening in the FDA, CDC. And just in general, he speaks a lot to the lack of accountability, which I think you were just talking about.
Yes.
People are divided because they think really there's two.
Can I just add one more thing that he's for?
Yeah.
That's really, really super important. And that's informed consent. It's understanding whatever it is that you're going to be doing in the medical world, from the smallest thing to the biggest thing, that you are 100% informed before the whatever it is happens.
Yeah. Yeah. And I think so. Basically, there's two camps. This is the division in summary. One camp thinks that he's asking really important questions and he's standing up for medical freedom. The other camp think that he's spreading misinformation, and his claims could make people lose trust in science. So those are the two things that I see. We can probably generalize people to two camps, and a
Okay.
lot of people in the camp of the spreading misinformation, or losing trust in the science, they're worried that his views, especially on vaccines, could harm public health. And they're also, I think people are irritated that he shifted focus from environmental advocacy, which I don't think he has. I just don't think people actually understood what he stood for.
Right.
But yeah, and then
Because his environmental, for the most part, there's hundreds of cases, so I wouldn't even be able to keep those all in my brain. But when you look at like especially the bigger ones, they were, bottom line, it was about public safety and health. I mean, that's what it was. He's not going out there like, fighting for the land, or I don't even know. I can make a lot of really snide comments in that regard, and I'm going to refrain. But he's not out there. He to use a Yellowstone reference, he's not Summer. He's not
yeah,
the character Summer. He's not
yeah,
her. He really is looking at big view, and he always has, and it's really been about
health.
responsibility of these companies that are polluting the land, that are polluting our water, that are like, those are the things that really came down to personal injury and harm.
Yeah,
So yeah.
yeah, yeah. And so it's kind of like both sides are looking at this from health and freedom, but they're coming at it from different angles. And they're one side is focusing on collective, like public health policies, while what the other side is kind of leaning into individual rights and informed consent and freedom of choice. um and so
But isn't that American? Like, isn't that,
yeah,
to me, it's like Frida?
I think
Holy
they
cow, what do we do with that,
I think they both are. But
Okay.
I think one, like these public health policies, need to be evaluated, and this is kind of where you go back to, let's talk about the CDC and the FDA and what their job really was, and the NIH, right? So like let's dive into that, and like, where are these health policies coming from? How are we making them? I think there are a lot of there is a lot of good that public health policies can provide.
Sure. As
To
long
talk,
with the proper oversight, making
yes.
sure that it's kind of like that the agencies themselves are not so big that they don't know what the other side is doing.
Mhm,
I mean, like having accountability.
mhm,
And we don't have those things anymore in these agencies.
yeah.
That has disappeared.
So
But
yeah,
go
go ahead.
ahead.
I
Go
was just
ahead.
gonna say, let's break that down. So what were the original, what their original purpose, what's happened, and what's the goal? What is RFK? What's his goal? What is he really, when you listen to him talk, and you look at his career, I think is what's more important.
Yeah.
What's
And
what's the
I was
goal?
going to say the body of work is that's where his um ability to do what he's about to do comes from. Like, he's
Mhm,
not a 20-something-year-old here. Okay.
mhm,
He's been around the block a few times. He's had health challenges of his own that he has had to work through, from addiction to the dysphonia that happens with his voice, and I'm probably sure many other things. As a person, he's a very fit human. He seems to really take care of himself from that perspective, but he has had a lot of challenges as well. And so I think that he's also a big proponent for those individuals who are also going through the same things that he is too. Do you know what I mean? So,
which I think is probably the concern. But anyway, so just going back to FTC and CDC, or FDA and CDC. So their original purpose and what's happened. And
well,
is that important?
okay. Is that what? What were you gonna say?
I said, and is that important?
Well, I mean, I think that the where the importance comes from is that, how there was an original structure put in place for public safety of medications that were going to be given. So their job was to look at whether it was a drug or food, is that going to be safe for the public? And in the beginning, people are afraid of what'd you say? They're afraid of the science. They're afraid of.
They're afraid that his claims about food, about vaccines, about what's going on are against and will lead people to not trust the science. Because there's a lot, and even when you look at, I mean, we can talk about vaccines, but when you look at the food and everything that people are talking about and really pushing right now with food ingredients
Right,
and all
right,
these
right.
things, that the FDA and the research is showing that it's safe. It's safe for consumption. It's been proven over and over again that this stuff is safe. But everyone's then on the other side is saying, like, absolutely not.
Well,
And this is poison and it is harming our kids and it is, and that's where he's standing. And so people are saying like, oh, your claims are going to make people mistrust research and science.
Oh, okay. Well, okay. So if you talk about the beginnings of the FDA, Food and Drug Administration, food, drug, and then they kind of went into cosmetics as well. Like they've kind of, I mean, but you know what I mean?
Mhm.
So in the beginning, like, when was it started? Early 1900s. 4, 6, 10, somewhere in there, very early 1900s. It was because you think this was right after the Industrial Revolution. We were starting to make a whole bunch of things. And quite frankly, people were getting sick and dying because there was no oversight as to what was being created. Is it safe for consumption? Right. It really wasn't it wasn't this huge overreaching entity that it is today, and it wasn't corrupt at the time. I'm sure there's always corruption.
How is it overreaching
Because
today?
there was no over today.
Mhm.
No, I'm saying because it's like they've got their finger in everything. Anything they can make a dollar on, they've got their finger in. So it's the only thing that they haven't been able to. The only thing which is really interesting, and I've never done any research on that, but why have they not been able to regulate supplements? Like why? And I think part of that is there's not enough money being made. Like with any drug, if you can't make money on it, they really don't. There's no real oversight because this is all about money.
Well, what do you
Oh,
mean you can't
so
make
let me, well, no, like, so an example.
part of the problem?
Well, no, so an example, no, I'm gonna give you an example. Low dose naltrexone.
Mhm.
Okay, it is something that has been around for forever.
Mhm.
Pharmaceutical companies cannot patent it. They do not have and have not yet been able to figure out how to chemically reproduce it in a lab. So they can't make money on it because it can't be patentable.
Mhm.
So supplements can't be patentable. So the FDA has never regulated it. Like, because everything you see is always, this has not been tested by the FDA, blah, 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 right?
Mhm.
So that little disclaimer, because they can't make money on it. They're not regulating it. So that right there should tell you something. Like, they're not really concerned with public safety. Because if they were, they would be making sure that those supplements you're buying from, big box stores actually have in the capsule what's it says. Like, that should be their thing, right? I'm going to buy this brand, excuse me, of magnesium glycinate, for an example. And inside that capsule is going to be the 200 milligrams of magnesium glycinate that it says should be. We have no regulation on that right now. That should be what they are doing. Not telling me how to use it, what to use it, if I can use it, but making sure that the public, what it says it is, it actually is. The food industry, same thing. That's where labeling comes from. That's why you can read an ingredient label, and that hasn't been that long that you can actually have an ingredient label. And then they had to be labeled certain ways to know. But like, for an example now, tell me how this is public safety. You don't have to label it if it's GMO. You don't have to label it if it's bioengineered. They're not going to have to label it if they're 3D printing meat, because there's a huge lobby in Washington that fights against those labels. Well, those labels are public safety. Those labels are allowing us to understand what it is exactly that we're consuming and we're paying for.
Mm.
This is like, these are all corruption things.
So that this is kind of where I'm getting back to this division that's happening, is that regulation is a good thing. Public health policy is a good thing. It's not all about medical freedom and just do whatever you
Right.
do.
Right. It's about safety. It should be
Mhm.
about safety. Is
Mhm.
this safe or is it
But
not?
they're saying that it is. So when the FDA does, or the research that comes out on food chemicals or whatever, I mean, everything's a chemical, but food ingredients, and you could, red dye 40. Their FDA is over here saying it's fine, it's safe, but then you have the camp that's saying absolutely not.
Right.
This is what's happening,
But
and that's where it's like,
but then go back and look at, so for that instance, what's the lobby group? How
mhm,
much money is the FDA making from not announcing that this should not be used because of all of the, allergies and neurological difficulties that come from consuming this, right? So it's like the health implications of this have been studied
mhm.
and, have come out on the side of this is not safe for consumption. The FDA has a thing that's called GRAS, generally, GRAS, generally,
It's a food ingredient list. I've seen it, yeah.
yeah, but
And
it's
it's going
called,
in
no, no, but it's called generally something for consumption. Like, it's generally safe. It's generally safe. This
mhm,
amount of aluminum is generally okay. This
mhm.
amount of, glycophosphate is generally okay. I mean, you know what I mean? It's like they're
Yeah,
not.
'cause there's a lot of people that are like, "Well, it's quantity that actually makes the difference."
Yeah,
I
well,
mean,
and you and I know that that can be a yes and no, right? That can be that depends on your own physical, chemical, and genetic makeup. I mean,
mhm,
some people are, our bodies are really, really good at processing out anything that comes in that's toxic, and some people, they're not. It's
they're
why,
not, yeah.
it's why some people are affected by X, Y, and Z, medication or ingredient or whatever, and other people
Right.
aren't. So, some people have allergies, other people don't. I mean, it's like there's a
So I
million.
guess that just bringing us back
Sorry.
into, so what is he hoping? Why are we so excited that he's gonna be in charge of all this
I,
now?
I mean,
Over I guess.
from my own perspective, and I think I'm pretty excited about. I think I'm pretty aligned with the people that are excited.
Mhm.
I think the opportunity to clean up these agencies. I don't care if he fires every single freaking person. I really don't. I mean, I doubt that he's going to. I know, people want to say, oh, he said he's going to get rid of all 600 people. It's like doubtful. But there needs to be the people that are running these organizations need to be concerned about the public health and safety, not about their own lining their own pockets, not about lifelong appointments and being paid bajillions of dollars a year to, fast track or, no safety studies whatsoever. But yeah, let's give this to the public because I just got paid $40 million from this company to make this happen, and all the perks that go along with it, and all the, jets and trips and all the things like that.
Bottom line is we're not trying to get rid of regulation.
No, we're
And I
trying to,
think that's
what we're
where the
trying to do is put
concern.
people in there that
Right,
aren't corrupt.
right. And I think part of the concern is that, oh, things are gonna get more unregulated and public health is gonna go out the window, and, but
No,
that's never been the intention.
no, not at all. And
Go ahead.
I was gonna say, and other reasons to be excited is personal freedom. The rhetoric that happens in this country drives me insane. The big one being Sorry, and if we can always edit this out if you would like. But the big one being my body, my choice. I want to scream every time I hear that because it wasn't my body, my choice during the COVID epidemic and people being forced to take vaccines. It's not my body, my choice with the current vaccine schedule. It's not my body, my choice. I can't go to work or school or college or whatever unless I'm injected with something. It's like, let's just talk about this for a minute. It's like, I want my body, my choice. If your choice is to say, hey, you know what? I think that this X, Y, and Z medication or vaccine or whatever is going to benefit me from a health perspective, then I'm going to take it. That's my choice. But on the other side is like, if I decide that I've done the research and I've decided that this isn't going to benefit me, I don't want to take it, there shouldn't be any retribution for that. None, zero. I don't lose my job.
And
I don't
hopefully that's going to go away.
correct. And the whole
We're
thing
not
about
taking
choice.
away access. Yeah.
No, absolutely
The
not.
goal is not to take away, and nor has it ever been to take away access to these things.
No,
It's
not
just
no.
freedom to choose
Correct.
if you want it or if you
It's
want to
like
give it to your child or whatever else.
exactly, and you shouldn't be penalized from anything by
But the
making
problem
choices.
is that I'm just going to play devil's
Go
advocate. The
ahead.
problem, especially in the vaccine conversation, is that people say that that's a huge public health issue. It's a community issue because people that are choosing not to do it are now endangering the lives of the masses.
Sure. So do people say that because of this
I
concept of
think
herd immunity?
I think that it's coming from the fact that people believe that vaccines have eradicated diseases, and that the concern is that now that people are getting into more anti-vax or not vaccinating, that these diseases are coming back. And
That's a whole nother conversation. I
well,
mean,
I'm just saying his stance, one of his big stances is on vaccine safety and policy and vaccine schedules and the efficacy of vaccines and all of these things.
yes, and they should be
Um,
studied because, I mean, people don't even realize that a lot of the vaccines that we have on the market today have never been studied for safety. Never been studied for safety.
like which ones? I'm just doing this to provide more information. I'm prodding you for example.
Okay, I'll give you a good one. MMR. That
Mhm.
vaccine has never been studied for safety to be given in combination. All three, never, not one
In
study. And
combination.
anyone out here who sees this to find a study where that vaccine was actually studied in giving it as a dose of three different
In one.
vaccines in one, challenge you to find anything, but yet it's on the schedule and your children are mandated to have it.
Mhm.
There's a question. I mean, that's a question to be asking.
Mhm.
So I mean, that's just one that pops into my head. But
Mhm.
yeah, I mean, it's
I was just saying that's the concern, right? The concern is
sure.
that our medical freedom and our ability to choose and what he wants to do is going to harm public health,
But it's
especially in the vaccine conversation.
not. I mean, it's like this
And
whole
people are becoming more and more skeptical of vaccines, and so the people are saying, like, there's mistrust in the science. Vaccines are proven to do blah, 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 and we all need them, and this is a public health regulation, and everyone should be getting their vaccines. He
yeah,
lives in a very different camp.
sure,
Um,
but he's in a different camp based on science. So, I mean, I'm sorry, but it is, and if I mean, I could talk on this for a long time too,
that's
but
okay.
based on the whole herd immunity, that whole entire conversation, and it was some point in time, it started to be included with the concept of vaccination, but herd immunity is actual and natural immunity. It is something where if you acquire a disease, then you're not going to get it. And the more people like chicken pox, for example, or measles, which measles are not deadly. I mean, yes, people die from them in third world countries, but not in America. But it's like, or in Western society. But gosh, I lost my train of thought because there were 14 of them going through my brain. But herd immunity isn't everybody gets vaccinated, and oh, if I'm vaccinated, you're not, so I'm protecting you, and you're not doing your share. It's like, no. Why do you think you have boosters? I'm sorry, how many measles vaccines do you have to get in a lifetime? How many boosters do you have to have for everything? Get your flu shot every year. If you even look at the CDC's website information, it's less than 10% effective. Why are you doing that? Why do you inject yourself with something that's less than 10% effective? Because the commercials tell you, oops, sorry, ouch. The commercials tell you to do that. Like, it's, or your doctor or your pharmacists now are, I guess, practicing medicine. So, it's crazy because, and this is what he's going to do, is to start to rein in some of this actual misinformation, and hopefully re-educate the public on, what the efficacy is for real. Like, you have to dig so deep to find this information, and you shouldn't. It should be a button on the cdc.gov website. Vaccine efficacy, boom, push it. Here it's all listed. Vaccine injury, boom, here it's all listed. Vaccine effects, boom, here it's all listed. It should be so easy for you to find that information out so that you can make an informed decision. Because right now, you know what your informed consent is when you go into a doctor's office and you get a vaccine. This is mandated by the CDC. This is the rule. I give you, now injected you. Oh, here's your VIS, your vaccine information sheet. Here you go, take that home. Now you've been informed. After the fact. I mean, it's infuriating. It's infuriating. So those are some of the things that I'm excited about, that he's going to be able to be giving us more access to more information, so that if we are choosing to do these things, it's not by mandate. It's not because the government is telling you to do something. It's because you have done your own research. You've been given the correct information about, the safety and efficacy of a particular vaccine or medicine. And then you are able to make a choice for yourself and your family, what you're going to do. And to me, we should have complete autonomy over like what decisions we get to make about ourselves. Like, no one should be telling me what to do or how I'm going to do something. And that,
even if it harms, and I think that's the thing where it's like, even if it's at the detriment to other people.
what detriment? That's
No, I'm saying this is the argument. I agree with you.
No, but I'm just saying.
I'm just playing devil's advocate of saying, like, the concern is that this is going to be at a detriment to public health, that these diseases are going to come back, that vaccines have eradicated diseases, that people in third world countries that are susceptible to dying from measles should have access to vaccines.
And they will. Hell, we use them as our guinea pigs. So, they already get the vaccine sometimes before we do.
Well, that's a whole other
That's a whole nother wormhole. But we have used Africa as our dumping ground for, yeah, exactly. It is disgusting. So I'm just saying, and then we could have a whole nother discussion on vaccines and why they were effective, or why they seem to have been effective, what really happened in society. And pretty much, I think if you follow any vaccine trend, from the beginning, from, way back in the early 1900s to today, you will see that the natural, look at epidemiology records, the natural curve of that particular disease had already begun to
come back down.
Yeah, before the vaccines were even introduced.
Yeah.
So I mean, this is not hard to go figure out. I just think we don't have access to information. And it's so, I mean, like, and you and I talk about this all the time about women not even understanding how their own bodies function. Like, we have been done such a big disservice in every aspect of our health and safety that, that's what's exciting, that the cover is going to be pulled back, or like, like the Wizard of Oz. It's like, don't look behind the curtain, don't go behind the curtain. Oh, no, I'm going behind the curtain. I want to know what's going on back there. And that's the exciting part.
That's the exciting thing. I think that, and just bringing it down to like, that's what's exciting for us. And bringing it full circle, health literacy informed consent, these should be the forefront of the Make America Healthy Again part of the problem across all socioeconomical backgrounds, across whatever the barriers are to health out there from a community standpoint, from a, whatever that standpoint. It is the number one thing that can make the biggest difference moving forward, um, for people to be healthier,
Oh, I know.
you know,
That was, yeah.
preventative care, whatever you might want to call it. But it's like health literacy and education should be the number one thing that we're doing. We should, there's a lot about, and I make jokes all the time about people being so concerned about Fruit Loops, and these little ingredients in foods, and like it's great, like fine, like it's a little win, and it's great.
Yep.
Removing some of this stuff from food, okay, but if you're not even understanding, um, you know, basic physiology, biology, because no one's ever taught it to you, or you're not understanding, like you said, what's behind the curtain, you're not getting all the information, um, you know, it, it doesn't make that much of a dent, because processed foods, ultra processed, they're always going to exist. The
Oh, I
easy,
know.
it doesn't like, but if you're not
What's dinner?
informed enough
Everything's
to,
processed food. Like,
and it doesn't, and sometimes
doesn't
processed
matter.
food is actually helpful and can be nutrient dense too, but that's a whole other conversation. But um, it, yeah, the choices and having the understanding is important, and that should be across
Yes.
all levels. People should understand the decisions that they're making, and then go on and make your
Make your
decision.
decision. I know.
Access
Freedom. Yep.
to access to information. And I do think one of the things with RFK, and we've talked about this, like we're hyper focused right now on food ingredients, but he's actually looking at things from a better standpoint when we're talking about like access to good food, healthy food. I think that's a really important conversation. I think it has less to do with Fruit Loops and more to do with our farming practices, and at the source, and again, education.
Yeah, I
Uh,
think we should be flipping, like, the government pays farmers to not farm, right?
mhm,
And it's like, oh, no, 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 we should be flipping that and giving it to the farmers, the small farmers, the small family farms, the local farms, the
mhm.
people that are in our communities that are trying to get, good, whole, natural food to our
Affordable.
tables.
Yeah.
Yeah, that we should be subsidizing them so that it makes it more affordable for everybody else. And,
Mhm.
that should be the conversation. And, and shut Bill Gates down. He and his groups are destroying our food. We used to be such a healthy country. We used to have access to such good food at good prices. Easy,
Mhm.
anyone could easily afford to eat. And
But it has little to do with Kellogg and more to do with,
right. No, you're right.
like, we're focused so heavily on, like, boycotting cereal,
No.
which yes, they're ultra processed foods, and we need to put all of that effort and anger into sourcing food at
Yep.
that level, so that that food is more accessible. Because great, you could take red dye and ingredients and things out of the ultra processed foods, but people who can't afford this food over here, they're still gonna be lacking in nutrients. They're still gonna be lacking in the things that they need, regardless of, great, the red dye is out of it, but like we're still not giving access. We're still not doing the thing that's actually going to push health forward, even from
Right.
a longevity or preventative standpoint.
Yeah.
You're still, it doesn't, it's the energy needs to go. But my point is in saying, it's like, I think that there's a lot on the internet about food ingredients in processed food, and I think RFK's been talking about it, and people are like latching on to that, which is fine, but dig deeper into the things that he's done and in his career and what he actually wants to do with farming practices and all this is really good stuff, and we're not talking enough about that.
Right.
And I want more energy towards that, more energy towards education, more energy towards health literacy, and true informed consent. So
Right.
you can have those conversations with your doctor on an intelligent level. And is this medication good for me? And how do I understand my body? Like you were saying earlier, it's like some bodies can take more than others, or whatever it is, you know. And we're not even able to have those conversations. Teenagers don't have access to information about women. I From a female standpoint, I get really passionate about next generation and these kids that are being kind of um they're what they're being given as healthcare is like such a detriment to longevity and preventative health, because they're not understanding and their parents aren't even understanding, again, health literacy, what's actually happening in their bodies and how to support themselves. And again, all of this, and I think part of, just to flip really quick to like the concern, I do have some concerns about some of this. And one of the big ones being that the health and wellness industry isn't regulated. It's in this huge money making business, trillions of dollars. There is a
Almost
lot
as
of
big as it, didn't it
corruption.
surpass in 2024 or 2023? Didn't it surpass the amount of money that pharmaceutical companies made? Or it's really
I think
close?
it's pretty close.
Yeah.
But the point is like this is also on this side a hugely unregulated industry. Supplements are super unregulated. There's a lot of corruption over here
Yeah.
too. And my concern is with RFK and Make America Healthy Again, it's becoming more mainstream, and there's more people popping up that don't have a full understanding or education or background, and they are pushing unregulated supplements that they don't understand the human body, and there's still a lot happening that can cause harm on this side too. And I see it snowballing, and it's continuing to snowball, and so I have concerns there. But again, being in the industry, I feel like we have such a responsibility. Those that are in preventative healthcare and more holistic healthcare, that have medical license, that have the education, that we have a responsibility to make people more health literate, to educate, to like, I feel so strongly that that's like part of the reason why we're here. Um,
Mhm.
it's not to, I think the health and wellness industry does such a good job at convincing you that you're broken and that they have the solution to fix your problems. And that's not the case. And
No.
what we really should be doing is, yeah, teaching more education, more about health literacy, more about how to advocate for yourself, more about the conversations about vaccines or whatever it is, giving you more information, helping to push policy that really gives you more information, that pulls the curtain, helping to push more access and give more resources and energy to providing access to better food or whatever it is, right?
Right.
But um but as
But to your
but we are,
concern, well, I was gonna say, to your concern about the snowball effect kind of a
yeah.
thing, it's like there's a personal responsibility, of the person. Like if you're going to follow somebody's advice, I would make sure that they have the background and knowledge in order to be giving that advice. It's not just an influencer person, pushing a particular product that, is gonna, I don't know, make your skin glow or, rainbows come out of your ears.
Mhm.
I don't even know, but it's like, here's like,
But the idea, yeah, but there's this general idea happening in the health and wellness industry that you can be good, that you can just like live your life without
oh,
any ailments, and that's just not true. It's just
no,
not true.
no,
And
but
what it does is it puts, and I think there's a lot of concern with the Make America Healthy movement, that people that have chronic illness and have these issues,
sure.
and that they're going to get pushed aside, that they don't fit the narrative, that it's all about personal response, like it's all about your choices and lifestyle and food intake, and that you have full control over everything and you can lead this perfect illness free life. And what we're doing to these people over here is like really really not okay. And it's also just like not true. If you're alive, your body's going to continue to respond and react to your environment. Everyone's going to get sick. Everyone's going to encounter ailments in their life. It's kind of the
Yeah,
go ahead.
if you're no, if
I'm
you're
just
alive,
saying like
yeah. But I
there
would
is
say that in that chronic illness space or whatever, it's like you're going to get sick. Okay. And some illnesses, can be
everyone's immune to that.
but if you are generally following health, a more healthy lifestyle, whatever, we won't go all the way into that. But when you come up against a bacterial infection that, you pick up, or, it's like your body can respond and recover much more easily. You end up with, oh, look, I can actually take a medication. I can get rid of this bacterial infection, and I'm going to, be right back to where I was in a short period of time, versus someone not being able to have the resources in order to correct that. Do you see what I'm saying?
Right. I see what you're saying. What I'm saying is that there are things that are also just out of our control, given
Absolutely.
our environment, our genetics, our all of these things.
History.
And
Yep.
and we are not guaranteed just because you take care of yourself. You're not guaranteed perfect health
Right.
because there are things that are out of our control. The point of what we do from a health perspective is obviously education, but it's how do I prevent preventable things?
Mhm.
Because there are lots of illnesses, chronic illnesses, diseases that are preventable.
Yes.
So how do I prevent? How do I increase longevity? How do I make sure the majority of my life I'm understanding and living in harmony with this
Right.
and responding appropriately to the signals and the symptoms that it's giving me so that I can feel good majority of the time. That does not make me immune. It does not make you immune to things in life that happen. Sometimes we have big stressors that are out of our control that can create illness. Sometimes we like and it's a very normal thing. And I think one thing that's happening in the health and well is we're marginalizing a lot of people that and we're saying it's some kind of moral failure where you're just not doing enough
Mhm.
if you're sick. And I think
Right.
that's wrong. And I understand why they're concerned because the narrative that the Make America Healthy Again movement is pushing is sometimes that narrative that it's all about healthy lifestyle and it's all about how you live and we're in total control. And that's not entirely true. And this is also why there needs to be a marriage between preventative healthcare, holistic healthcare, and conventional medicine that can help and does help mitigate illness and disease. There's a line, there's
Yep.
a marriage. Go
Yep.
ahead.
No, I was just gonna say, I don't make America Healthy Again movement. I don't know that's coming from Kennedy per se. It's coming from all of the noise around it. You know
Yeah.
what I'm saying? It's like, so it shouldn't be something to be feared. He's not going, oh, well, yeah, you made yourself sick, so we're not going to help you. No, that has,
But
like,
there's so much
yeah, but
noise.
that's just people talking. That's not fact.
But
Like,
people are
let's focus
scared.
on what's
I
right.
know, but people are scared.
But let's focus on what's true, because that's not going to happen. And,
Mhm,
in reality, if
mhm,
you are suffering from something and some of these changes are made, it's only going to
mhm,
help your case, your ability to be able to overcome some of those things.
mhm.
This is not going to be a detriment. It's actually a positive. And
Right.
so, and funny enough, a group of them went to the UFC fights, right? And they're all on the plane coming back, and they're all eating McDonald's. I mean, this isn't, they were like literally, and the memes were
Mhm.
like, yeah, we'll make America Healthy Again starts tomorrow. But and it was funny. It's funny, but it's like they're normal.
No,
Be a
people are
normal
angry
human.
though.
What?
Yeah.
But it's
People
not,
weren't happy with that.
whatever. So what? But that's part of the problem. This isn't
Mhm.
about having some state of perfection. It's about getting rid of corruption. It's about being more transparent. It's about doing some things to correct what we know has been harming people, but not
Mhm.
taking away your choice. Not,
Mhm.
it's like, again, a whole nother recording on fluoride. But you can, if it's your choice to do that, those choices will still be there.
Yeah,
So
you can still get fluoride toothpaste, and you can still go to the dentist and get fluoride treatments. You can get fluoride in different things.
yeah,
Yeah.
yeah, mouthwashes, all that kind of stuff.
Yeah.
It's not being taken away. It's just, again, it's about transparency, informed consent, making your own decisions, and doing what's right for you.
Mhm.
That's it, period of
Because
end.
some of us don't want fluoride in our water, and we're getting
Yeah.
pushed. Or we have to spend a crap ton of money on these huge filtration systems in order to have water we wanna drink,
Or eight
which
dollars on a tube of toothpaste without fluoride. I mean,
yeah, without
it's
fluoride, yeah,
ridiculous.
$11,
Oh,
$11.
okay. But yeah, so I think that when all of the noise dies down, over the next few months, I think people
That's
are going.
funny. You think that the noise is gonna die down.
Yeah, because I think once things start happening and people start to see the positive changes that are going to come from it, it's like they're going to be in a much better place. I mean, I told you my dissertation, I wanted it to be on health literacy. My
Mhm,
advisor made me make it I still did health literacy, but it was a very
mhm,
small, tiny little piece of one particular nugget of health literacy. But health literacy and informed consent, like those are like some of my passions. Like I am constantly, encouraging our own clients to be, making sure that they understand the things that they're going to undergo with their conventional providers. And I would say the same for if you are choosing to do alternative health, you better know exactly what you're getting into. You have to learn what the questions are to ask.
mhm,
And those are things that we're not taught because transparency isn't a thing in medicine. And I don't understand. We're consumers. Like we're
mhm,
consumers of medicine. We are consumers of this. It is a service. You want to go buy a pair of tennis shoes, you research the hell out of, oh, is this good for walking? Or if I'm going to do 10,000 steps a day, or I want to go for a run, what tennis shoe is the best? Or which one's the cutest and still provides me some support? Whatever. We'll spend hours on that. But, randomly picking a doctor and then just going in and believing everything they say, we don't spend 10 minutes. So we need a shift, into that the whole world of making responsible and informed decisions.
mhm,
And that's what this appointment is going to allow us to do.
mhm.
So anyway.
Yeah. All comes back to education and empowerment.
Yep,
Really.
yep.
Um, but yeah. All right. Well, this is kind of just a brain dump. These are well formulated, but just kind of a brain dump of everything we've been thinking and processing as all of this unfolds. We get
Hey, but
if you're curious and want more information, if you want a video on a deep dive on vaccines, if you want a video on more like health literacy and what we mean by that, and informed consent and what you should be looking for when you're working with practitioners or questions you should be asking, we'd be happy to do that. But
and we
just
have resources too, if you want, you don't
Mhm,
have to like always listen to us. I mean, there are people out there that have done some amazing videos on, vaccines, and there are some great books written on the histories. And I mean,
mhm.
there are resources out there to, to be able to consume yourself and come to your own conclusions.
Yeah, because that's the
Um,
thing. Like this should be critical thinking. You can go look at both sides,
yep.
read what they're putting out on vaccines as far as research, and then read the other side. See how you feel about it. See what you actually think. This is about critical thinking more so. And I think part of this can go back to the laziness and human nature of people. But I also think it's a response again, you don't have to become an expert, there should be a level of trust and education and information that's being given to and taught to practitioners, providers, that's not funded by pharmaceutical companies. That's not corrupted information, and there should be transparency, so these people that are learning and interested and want to do this and want to develop programs and help with health have all of that information so that you can. I think people need to be able to trust their provider. Like if I'm not, if I need a lawyer, like sure I can do my own research or whatever, but I'm also trusting that the person that became an expert in it has done all of that. But what's happening now is our medical professionals, our providers in the holistic and conventional are they're not getting all of that. There's still a curtain. There's no transparency. There's no, you're not getting information on all of the things on a vaccine that you're giving to a patient. You're just told to do it. And if you don't do it, you're going to get fired. So essentially,
or no notices, or you're not getting paid by the insurance companies, or there's like we've always said follow the money.
yeah.
So, it's not hard to figure all of these things out and really see what's going on.
Yeah, but you should be able to trust the providers and the practitioners
Yes,
and people.
but that comes from
And
you. But that comes from you also being as informed as you can be, and understanding the questions that you need to be asking so that you can start to build that trust with the individual that's caring for you.
Yeah.
So
agreed.
Yeah.
All right. Well, we babbled for long enough.
But yeah, love to hear questions or feedback. So,
All right.
Okay, have a great
Next
day.
time. Until next time.